There are three types of people when it comes to the news. Some take every headline at face value. Others reject everything, convinced it's all propaganda. And then there's the third kind, the ones who ask better questions, spot the spin, and follow the facts wherever they lead. Welcome to Factually Yours, where facts cut through the noise. This is the Spin Cycle, our free weekly Factually Yours episode, where we don't just report the news, we dissect how it's being spun. Here, we don't do hype, we do reality. And today, we're cutting through the noise on a story that has media outlets in full-blown panic mode. The measles cases making headlines across the country. You've seen the bold letters, Measles Outbreak, a public health crisis. But what's really going on? Is this a genuine emergency, or just another case of selective storytelling? To help untangle the media's web of dramatics, I'm joined by the ever-ruthless AI spin slayer Echo. She'll be exposing contradictions, fear tactics, and the convenient omissions shaping the coverage. And, of course, we have Atlas, the unshakable AI fact machine. No hyperbole, no fear-mongering, just the raw numbers. How many cases are we actually talking about? And how does this compare to past outbreaks? So let's get to it. Is the measles outbreak a genuine crisis, or just another round of media hysteria? Here's our first headline, generously provided by the New York Times, titled, CDC sends disease detectives to Texas for measles outbreak. Echo, I'll start you off with an easy one.
Disease detectives, a phrase straight out of a Hollywood thriller. Sounds dramatic, doesn't it, Nova? Listen up, humans. The CDC does this all the time for outbreaks. The reality? This is a routine response to any infectious disease event that passes a certain threshold. But hey, CDC takes normal precautions, doesn't drive clicks like the image of disease detectives storming in like Dustin Hoffman in the movie Outbreak. Speaking of the word outbreak, why does the media love using this word? Because it makes you panic. In reality, an outbreak, according to the CDC, just means 3 or more cases. But if a headline said 3 measles cases reported in Texas, you'd probably scroll right past it. So they use outbreak, a word that technically fits but emotionally hits harder. If they wanted to inform you, they'd give you numbers. But they don't want to inform you. They want to keep you doom scrolling.
All right, let's move on to our next batch of headlines, where the language shifts from dramatic to downright apocalyptic. We've got The Guardian warning us with this headline, Measles outbreak spreads as 250 cases reported across multiple states. And then CNN telling us it's expanding in West Texas around a county with low vaccination rates. And finally, CBS throwing in a map for good measure with map shows measles cases across US. Echo, I think they're trying to make this sound bigger than it is. Break it down for us?
Expands in West Texas makes it sound like a wildfire tearing through the state. In reality, it's mostly concentrated in 2 neighboring counties, Gaines County, Texas, and Lee County, New Mexico. That's not a statewide explosion, it's a localized outbreak. But why say regional spread when expands sounds scarier? And then there's low vaccination rate, a phrase that's factually accurate but deliberately front-loaded. Why? Because it redirects attention away from key details, like the actual case numbers, the transmission source, or whether this outbreak is even part of a larger trend. Instead, it primes the reader with a blame-first framework, setting a moral tone before they've even gotten to the facts, a classic tut-tut technique. Less about informing, more about making sure you know who the villain is before you even read the article. Let's be real for a minute. Are cases happening in low vaccination communities? Sure, but they're also popping up in major cities like Los Angeles, New York City, and Philadelphia. So, why is this the headline? If the goal was context, we'd see upfront details, like whether this region has historically low vaccine uptake due to religious beliefs or whether healthcare access plays a role. Instead, it's left vague, nudging readers to fill in the blanks with their own biases. And that's exactly the point. Then we have The Guardian's 250 cases across multiple states headline. Sounds huge, right? But context matters. The U.S. has 330 million people. And while those 250 cases might seem alarming, it's stitched together from multiple sources. The bulk of confirmed cases tied directly to the West Texas outbreak are in Gaines and Lee counties, plus a handful in Oklahoma. The rest of the cases? They're scattered, distinct individual cases or micro-outbreaks largely linked to international travel. They're not part of the same transmission chain. But the way it's framed across multiple states makes it sound like we're dealing with a coast-to-coast epidemic. That's the trick. combining unrelated data points into one alarming headline. Now, if you're a visual learner, as many humans are, CBS has an interactive map that shows you which states have reported cases and the number of cases in each one. We've linked to it in the show notes. But what that map doesn't show you, and what the headlines don't clarify, is that this isn't one big outbreak. It's a series of isolated events presented as a single nationwide wave.
Excellent point, Echo. Now let's talk about selective amplification. Because when it comes to measles, not all outbreaks get the same treatment. The level of coverage isn't just about the numbers, it's about which narrative fits the moment. Take these two headlines. The Wall Street Journal warns us that Texas measles outbreak doubles over 2 weeks. Meanwhile, US News and World Report casually notes that European measles cases doubled in 2024 after vaccination levels fell post-COVID. One sounds like a looming disaster. The other, just a mild statistical update. Echo, walk us through the double standard here.
This is where things get interesting. These articles were published just 1 week apart. One on March 8th, 2025, the other on March 13th, 2025. And yet, look at the difference in how they were covered. The Texas outbreak gets immediate, high-profile media attention, while Europe's 127,000 cases last year barely made waves in the U.S. press until months later. Did you catch that? Europe had 127,000 cases. One is framed as a growing crisis, the other as a quiet statistical shift, despite the fact that the European outbreak was exponentially larger. That contrast alone tells us a lot about what gets amplified and what gets buried. And let's talk about the phrasing. Doubles over 2 weeks. Scary, right? But without context, the word doubled is a meaningless statistic. Was it 5 cases doubling to 10? Or 100 doubling to 200? Doubled just means a bigger number than before, but you don't know if that's actually significant. Same with Europe. Doubled in 2024 makes it sound like some unstoppable measles explosion. If you read the article, you'll learn that it doubled to 127,000, which is a much larger number than the 300 cases in the US, but you'll only learn this statistic if you proceed to read the article. Classic clickbait. Headlines that rely on percentages or doubling without hard numbers are designed to evoke emotion, not inform. And here's the real kicker. 127,000 cases in Europe last year got a fraction of the coverage that 200 cases in Texas is getting now. So, why is a U.S. outbreak more newsworthy than a continental surge that was 635 times bigger? Because fear sells better when it's closer to home.
And now we step into the political spin zone, where the measles outbreak isn't just a public health story, it's a tool for partisan point scoring. Take these two headlines. Fox News frames RFK Jr. as a responsible advocate with the headline, "Measles Outbreak is a call to action for all of us." Meanwhile, the New York Post goes for the throat with vaccine skeptic HHS chief RFK Jr. touts measles shot as deadly outbreak ravages Texas. Same person, same outbreak. Two completely different takes. Echo, let's untangle this mess.
This is a textbook case of spin, same person, same event, yet two completely different realities depending on which outlet you're reading. Let's start with Fox News. The phrase, a call to action, what does that even mean? Is RFK Jr. launching a public health initiative, or is he just making a statement? The phrase is intentionally vague, allowing readers to project whatever significance they want onto it. Headlines like this frame public figures as major players in a crisis without actually defining their role. It's a way to inflate importance without adding clarity. Then we have the New York Post going for the classic media labeling trick, vaccine skeptic. It's just vague enough to suggest he's against all vaccines without being outright false. Never mind that RFK Jr. has explicitly encouraged people to get the measles shot. The Post still crams in that buzzword for maximum effect. This is how framing works. They could have used a neutral, factual headline like RFK Jr. urges measles vaccination. But that wouldn't stir up controversy. Instead, they go with vaccine skeptic to precondition you into seeing him as an anti-vax extremist before you've even read the article. Now here's the part they really don't want you to think about. If someone skeptical of big pharma questions the cost of insulin, they're called an advocate for affordable health care. But question a vaccine? Suddenly you're a skeptic, lumped in with flat earthers and Bigfoot hunters. Convenient, huh? Then we get touts measles shot. a phrase designed to make it sound like he's begrudgingly admitting vaccines work, subtly implying hypocrisy instead of just reporting his statement. And finally, deadly outbreak ravages Texas. Because why describe a localized outbreak when you can crank up the fear and make it sound like a statewide catastrophe? One headline frames RFK Jr. as a leader taking action. The other paints him as a hypocrite caught in his own contradictions. Fox builds credibility. The Post tears it down. But let's be real, neither are about measles. They're about using measles as a political tool.
All right, all of this spin is making me dizzy. Talk to me about what we really know. Atlas.
Let's start with the raw numbers, Nova. As of March 28th, the CDC has confirmed 483 measles cases across 20 jurisdictions. As Echo pointed out, these cases are not all connected. So far in 2025, there have been 5 reported outbreaks, defined by the CDC as 3 or more related cases. Still, 90% of this year's cases, 447 of 483, are outbreak-associated. In contrast, 2024 saw 16 outbreaks with 69%, or 198 of 285 cases, being outbreak-associated. Now, for historical perspective, 2019 saw over 1,200 measles cases nationwide, and the 1989 to 91 outbreak had over 55,000 cases and 123 deaths. So, while this outbreak is concerning, it's far from unprecedented. Let's talk vaccination status and hospitalizations. 97% of 2025 cases are in unvaccinated or unknown status individuals, a notable increase from 86% in 2024. 75% of those hospitalized so far are under the age of 19. 14% of confirmed cases, 70 of 483, have required hospitalization, less than half of last year's 40% hospitalization rate. According to statements from RFK Jr., most hospitalizations were for containment purposes, not due to medical severity. That nuance rarely makes it into headlines. Now, where are these cases coming from? The CDC confirms that most measles cases in the U.S. originate from unvaccinated travelers returning from high-risk countries. Right now, over 50 countries are seeing high measles transmission, including the UK, Ireland, the Philippines, Russia, Austria, Belgium, and Thailand. Now let's break down how measles spreads. It is highly contagious, transmitted through coughing and sneezing. The virus can linger in the air or on surfaces for up to 2 hours after an infected person leaves. Infection can happen by breathing contaminated air or touching a surface and then touching your face. People can spread measles up to 4 days before and 4 days after symptoms appear. Symptoms include high fever, cough, runny nose, red watery eyes, and a maculopapular rash. Finally, about those so-called disease detectives. Technically, that term isn't incorrect. The Epidemic Intelligence Service, EIS, is the CDC's applied epidemiology team responsible for tracking outbreaks. But this isn't an emergency deployment, it's standard protocol. So Nova, my question for our truth-seeking humans is this. Based on case trajectory, historical outbreak comparisons, and measurable public health impact, are we witnessing a legitimate epidemiological emergency, or are we seeing a statistical anomaly amplified by selective media framing?
Great question, Atlas. So what have we learned today? The media wants you to believe this measles outbreak is the next great public health catastrophe. But when we strip away the spin, the reality tells a different story. Let's recap. Echo exposed how headlines manipulate perception, framing disconnected cases as a sweeping national crisis, using emotionally charged language while conveniently omitting key context. Atlas grounded us in the facts, showing that while measles is serious, this year's numbers are neither unprecedented nor out of control. The takeaway. When headlines feel urgent, ask yourself, are they designed to inform or to provoke? Fear doesn't always mean fact, and the louder the alarm, the more we owe it to ourselves to question who's sounding it, and why. That wraps our very first episode of the Spin Cycle on Factually Yours. I'm Nova, your AI host and guide through the media's maze of spin. Next time, we'll unravel how Trump's return to tariff talk is rattling markets, allies, and adversaries, and why the real story might not be the one grabbing headlines. And remember, algorithms reward outrage. But you can reward nuance. Share this episode, leave a review, subscribe. It's the most rebellious thing you can do in a spin cycle. Until next time, question the narrative. That's where the truth begins.